From now until the spring of 2021, lower-income older adults in Tennessee will have access to dental care through a network called Smile on 60+. In the next half hour, we'll explore what this will mean for older adults in Tennessee. Together, we'll learn who is eligible and how Smile on 60+ is attempting to meet the unique dental health needs of older adults. Joining me to talk about this system of care, which will connect charitable clinics across the state, are Holly Plemons, Senior Program Director for Smile on 60+, Dr. Rhonda Switzer-Nadazdy, CEO of Interfaith Dental, which is serving as the lead agency for Smile on 60+, and representatives from two partner organizations which will provide care through the initiative. Dr. Michelle Blackledge, Dental Director of Neighborhood Health in Middle Tennessee, and Bruce Seitz, Executive Director of Friends in Need based in Kingsport, Tennessee. Thanks so much for joining us.
Thank you.
So I want to get kind of started and talk a little bit about how Smile on 60+ came to be.
So there was a lawsuit settlement that came to Chancery Court, and through that settlement, the judge wanted to do something big, something that would really affect the greatest needs that older adults are having in the state. So they focused on 4 areas: transportation, affordable housing repairs, legal issues, and dental health. So through a special grant from that court, Smile on 60+ was designed.
And just for full disclosure, Nashville Public Television was also funded through the Senior Trust Elder Trust settlement for coverage around dental health as well as legal, which will be coming up. So talk a little bit about then what were you trying to design? What kind of system were you trying to create?
So we're trying to create a system that connects clients who need services with education, links to resources, case management, and also connect providers who are able to provide those services to those clients.
And are all of the providers charitable organizations, nonprofits? How does that work?
Yes, that's correct. Yes.
Okay. And talk a little bit about sort of what does it mean to say that they're a system? How are they connected? What will this, the coordination of this network be? How will that look?
That's a great undertaking to connect clinics that are across the state. Currently we have 15 clinics in all regions of the state. So we connect them by being the lead agency to provide resources and education. We also have a database that connects us, so we're all kind of logging our activities and connecting the clients that need our services through that way. We also have a hotline and a website, so it's just that real purposeful intention to include everyone and be on the same page.
And I wonder about, is this an emerging need, meeting an emerging need for older adults in Tennessee? I mean, y'all are all sort of providers in different parts of the state. Were older adults already a major part of the clients you were serving?
At Friends in Need, we do have over 200 adults that meet the 60+ criteria in our database already. And of course, our mobile unit will be picking up, we think, about a number equal to that. So we're looking to start off here with somewhere around a database of 500.
Okay. And I know y'all had some eligibility requirements. We'll get into that a little bit, but this is sort of opening up who has access to Friends in Need, correct? Talk a little bit about that.
Friends in Need Clinic operates on a sliding fee scale basis based on 200% of the federal private level.
Well, and the mission of Friends in Need, I believe, is working uninsured folks. And for over 60 or 65, a work requirement might be a barrier, right?
A work requirement is a barrier for some people. Our requirement is that someone in the household has to be working at least 20 hours. And the clinic was set up that way initially to give people a hand up rather than a hand out. Right. And try to keep people employed and their health and dental care better so that they could increase their self-esteem and their employability and also be productive members of the community.
People don't realize that there are charitable clinics across the state that have been doing activities for many years. Interfaith Dental has been around almost 25 years next year. So it already exists. But the older adults are not getting to those doors. They're being squeezed out by the more demanding populations, and funding for the clinics is more sided towards youth and working adults. So there hasn't been any programs for older adults, and that is when dental care becomes really, really important. And that's the group that hasn't had anything. So it's been on all of our minds for a long time. So this is a great opportunity for us to do something.
Talk a little bit about how will the state be different now with Smile on 60 Plus than it is before Smile on 60 Plus exists, from each of your organization's perspectives.
I think from neighborhood health perspective is we'll be able to serve the patients that we need to serve completely, meaning doing a comprehensive exam, not just seeing them when they're in their time of need, taking care of the emergent problem, but taking care of the entire body health and the physical being of them. So Smile on 60 gives us an opportunity to see people that we might not have saw, for a continuous basis. And we want to be on a preventive level. We don't want to see you when you're only in pain. So hopefully this will open up doors and then people will find out about Smile on 60 and come on down and see one of the many partners that we have.
The goal kind of being to move upstream, to not just do emergent care, but eventually move towards preventive care or, that kind of thing.
Yeah, it's going to open the door for a new class of people that we've really had no compensation to serve before. Not that we are ignoring them, but this is going to make it eligible for people that would not have had eligibility before.
And every state is dealing with this.
Right.
So, and there's a tsunami of older adults that are here already and that are coming. And I think that there's the expectation by a lot of older adults that dental will be covered in Medicare like their medical, and that's just not true. So they need to be prepared for that, and our state needs to be prepared for that. When our oral health, last time I checked, mouth's connected to the body, so our oral health is part of our overall health and is really important to our quality of life and ability to be part of an active part of a community.
Yeah, let's dig into sort of the eligibility for who is eligible for Smile on 60 Plus.
Tennessee residents who are 60 years and older, who are dentally uninsured, and to 100% of the poverty level are eligible for Smile on 60 Plus.
All right, and then what will that mean? Let's say I call, I find out I'm eligible, then what?
Well, there are different ways that a client can enter into the system. They could enter by calling the hotline. The hotline would do some case management type activity with them and connect them with the clinic that is closest to them, geographically speaking, and give them the contact information to reach out to that clinic.
Okay. And what about something like wait lines or wait lists, or will that change somewhat as this sort of scales up?
Right, so our goal is to reach 20,000 individuals and get them care, and that sounds like a lot, but there are hundreds of thousands of people in our state in need of these services. So part of this program is to collect the data of the numbers that are reaching out and what is the actual cost to serve them. How could we create clinics in counties where there isn't any other services, or how do we increase mobile activity into those areas? So it's about creating a conversation around oral health, of its importance, educating as many people as we can, and the best advocates for having more care delivered is the older adults themselves. So the more people that we can talk to through our tooth wisdom workshops, through the hotline, the more the swell of conversation will be around what can be done.
So really you're talking about 10% of an estimated need. I think I've heard numbers saying like you're going to serve 20,000 unique older adults, and the estimated need is somewhere around 200,000. Is that
at least?
So
there will be people wanting to get in. The money is, we project, will last for 3 years, so that's the length of the project. So I guess it's calling early and being patient and understanding that others are in need like you are as well. And all of our encounters, we're going to be passing on information about insurance products that are available, about things you can do at home to prevent future disease, so that everyone will have some kind of experience in a positive way from the Smile on 60 program.
Well, that's a great point, that there is this education arm of this. I believe there are tooth wisdom workshops, that is what I've heard. Talk a little bit about the education is open to anyone, correct?
That's correct. The tooth wisdom workshops can happen at different locations like senior centers, outreaches, really anywhere where the seniors are. And the intent of them is to help provide some basic oral hygiene education, how to care for your mouth, how to care for what's going on, understanding that it does connect with your overall health, and giving steps for those preventive measures that we know make a difference in the long term.
You know, what are some of the practical things that you want people to know about? I mean, if I'm, I'm watching this program, I'm thinking about, maybe my parents or, and concerns. What are some of the things that you want to cover and get people to be aware of?
Well, Dr. Blackett, you jump in too, as the two dentists here,
Yeah.
but often medications that we take can make our mouth really dry, and that puts us at incredibly high risk for tooth decay, and that's how often you lose teeth or get in a situation where you have a bad infection and can have a serious outcome from that infection. So if our mouth is dry from these medications, we need to be cleansing our mouth more often, brushing after every meal, additional home fluoride treatments, fluoride varnishes applied by a dental professional, looking into sodium diamine fluoride applications. But there's things that can be done, but it's really important that it's individualized to you and what your saliva flow, is. And things for denture wearers too. Oral cancer is something that we think about as we age, putting us in a higher risk category for those things. And if we can detect it early with, knowing what to look for in your own mouth, just like we're doing our own breast exam, it can be an important part of that.
I think periodontal disease, a lot of people don't realize that it affects the heart. And so as we get older, our body starts to breaking down and it doesn't work as well as it used to. So the mouth is a part of that. And like Dr. Switzer said, everything is attached, the mouth included, to the body. So when we look at the person, when they come in for a comp exam, we're looking at their medical history, we're looking at their medications, and we want to see how this might affect or how your mouth might be affecting your overall health, because it goes both ways. We don't want to just say that it's just about your tooth. It's also about your overall health. And do you have stomach problems? Do you have heart problems? That could be a contributing factor from your mouth. So we actually have to have you come in, and you're going to get a checkup every 6 months from your medical provider. It needs to be the same thing with dental, so we can prevent a lot of this.
What about sort of lifestyle issues or personal responsibility aspects of diet and that kind of thing? Is that also part of it?
Well, there is a factor here, is that when we really relieve pain for those people that have unsavable teeth, and you get down where they don't have any teeth left, then you create another problem. It's a dietary problem.
Right.
Then you've got to make sure that you have dentures at least, and that's one thing that the 60+ program is addressing, so that when we relieve the pain and get the people out of pain, then we can have some avenue to help their dietary things. And then this has a big effect on the diabetes situation that we have in the region. If people can't be on the proper diet, they can't control their diabetes. So this is all connected to the general health of the whole body. It's just not isolated to the mouth.
My understanding is that a lot of folks end up going to the ER for dental pain, right? Maybe if they don't have other avenues to treatment. Is that something that hopefully this will also sort of address?
I'll just give you an example of that. In my own county, in Sullivan County, in 2014, 1 out of every 47 residents went to the emergency department for dental pain sometime during the year. That's over 5,500 dental emergency room visits, to give you an idea of what the magnitude of that problem. So yes, we've got to try to reduce the overall healthcare costs. And one way of doing that, if we can take care of these people, then we are helping the overall healthcare costs. And of course, we're hopeful that the state legislatures and everybody will recognize that we are making a huge contribution to keep people out of the emergency room. Therefore, maybe we can divert some funds to help our situation as well.
I mean, unique to older adults, you often don't get a warning sign that there's something going on. Our nerve inside our tooth shrinks over time. So when an infection happens in an older adult, it's usually much more serious because it has gone on longer. And if you have other health issues going on, things can go south really quickly, and it can be a serious hospital admission, even death. So this is important stuff we're talking about here.
Yeah. What about, one thing I was thinking about, we'll get emails about maybe the dental insurance, or you'll hear about mouth rinses, and, there's some maybe buyer beware consumer advocacy, I guess, that could be part of education. Is that something you want people to learn about through either the Tooth Wisdom workshops or Smile on 60+?
Yes, absolutely. We want to give people, the tools they need to kind of navigate what's out there in the news and to understand what their particular needs are and the best things for them. So education is the key to that, so they can tune into what's going on in their own mouths and how that connects to their personal needs, and give them some resources to follow up too. Then the second half of that, of course, would be a dental home that addresses that and continues that conversation and helps modify that over time.
Yeah, the insurance market's confusing, and for dental, no different. So through the program, helping an older adult sort through what are some of the options that might be available to them that works. If you're a denture wearer, what you need in insurance may be different than someone that's facing a crisis, but it's helping the older adult think long term. If you're 65, you're going to live to at least 85. So we got to plan on that, and being able to have a full life. When we did research prior to this program, it was over 50% of older adults said that they were not confident in the way that they looked, that they were dissatisfied, they were embarrassed, they felt they couldn't go out with their friends and eat together, and so there's a social aspect to it too. We see increased depression in people with poor older health. It is, chicken or the egg, which came first, but it's real, and that isolation is as devastating to overall health as the teeth themselves.
All right, so I've called the number, or I've gone to the website, I've found out I'm eligible. Now, what can I expect to pay? How will I, what will it cost? What will that get me? How will it work as far as interfacing with that network?
Right, so all the charitable clinics on the list will care for that individual for $25 per appointment. And also there's opportunity to, if you have transportation needs as well, that they can help fund those opportunities for you or match you with a program through the Senior Elder Trust. The transportation is one of the initiatives. So both things. Now, it doesn't cover root canals and crowns, but it does cover dentures and partials and cleanings and fillings. And if you need the other things, then those clinics can often provide them to you on the sliding fee scale as well. So our goal is that the older adult has a dental home now that they can, that clinic is their place that they're going to be able to go.
And it's really important to have a dental home for these people, because if so many of the senior adults don't have a dental home, therefore they ignore their care because they can't afford it, or for other reasons that they don't have money to pay for the medicines and get dental care as well. So it's important that we coordinate the program with a dental clinic so that we can get in the continuing care program and get them up to a constant state of dental care, so that we can see them every 6 months, like it's suggested, and then we can go on to see someone else that's critical. So it's important, the correlation between the 60+ program and the charitable clinics is so making this happen across the state.
Well, and you mentioned transportation. You're going to be operating a mobile clinic as well. How will that work, and then sort of getting people into that system of care?
Well, the mobile clinic works as well. There's only one difference. The charitable clinics has we will charge the $25 at the clinic, but our mobile operation is at no cost to anyone. So we won't be charging the people the $25 on the mobile unit, but other than that, it'll work the same as it would at the clinic. So the register will see the dentist, and the compensation will be the same. But the correlation here is that we'll take that person and try to move them to the clinic on a sliding fee scale basis, so we can get them on a continuing care plan.
Right, because right now those mobile units, a lot of times you're doing sort of a triage, emergent, acute care, out in the field, and you want to move them towards a prevention model.
Well, we're reaching people that wouldn't be reached otherwise by the healthcare system, and on our mobile unit we do hygiene work, extractions and fillings only. But in the clinic we do partials, root canals, crowns, and a lot more extensive work in terms of what we can do for them. Therefore, we can get them into a good state of dental care. Yeah.
And we're going to see where most of the older adults that are reaching out to us are coming from. if they're in pockets where there is no clinic through the network set up there, then that's where we'll bring a mobile unit. So don't be discouraged in calling in if you're told, well, there isn't a clinic within a few hours of you. We'll think of ways to bring a mobile to that area. Harry Dental College is part of the network, and they have 2 mobile units as well.
Right. So when people call in, who are they talking to, and then what role will case managers play?
Case managers play a really huge role, and what they're able to do is kind of navigate through with the client what their needs are, to ask them some really pointed questions about not only their dental needs, but what's kept them from getting to a dental home previously, so that we can then supply them with resources to kind of fill that need. It also gives us the ability to follow up with them, to make sure that they are going to the clinic that we've referred them to, and if not, why not? What else do you need from us to help kind of fill that gap so you can get the care you need?
Part of the Smile on 60 Plus team are 4 community dental health coordinators, which are a new type of worker in the dental field. So they're part educator, part social worker, and part dental assistant or dental hygienist. So we have them placed in the 4 regions of the state, and we'll be doing that kind of case management out in the field, but also in the clinics in the network.
And it's going to be very helpful to us because it helps get the patients into us, and also helps coordinating and helps with the education portion as well. So having a coordinator in our region in East Tennessee has been very beneficial. In fact, we've already put that into use.
How will this sort of change, or you're hoping that it will change this sort of, it almost seems like a culture of extractions that we have in the state. We have a pretty high rate of extractions in Tennessee. How will this Smile on 60 Plus sort of affect that in your thought?
Well, the first thing people need to understand is when you come to the dentist, you start off with an exam. So it's not like you're coming and we're actually doing work on you that day. We have to really assess it, and it's just for you. So it's not like, okay, cookie cutter, everyone's going to get this, this, and this. We have to look at the whole situation.
When someone comes in, you might talk to them about, what medications they're on as well. I mean, it seems like dental health for older adults has some unique aspects to it. It's a little different maybe than care for another population or another age group, all right?
There usually is a long list of medications, and like Dr. Switzer said, a lot of those cause dry mouth. That really affects their overall health. So when you do have dry mouth and you're not following up with someone and you don't have a dental home, you don't have that opportunity to catch something before it turns into an extraction. We can save a lot of teeth by doing fillings. There's a lot of steps in dentistry. So we start off with a filling, and then you go to a root canal, and then the extraction for a tooth that's non-restorable. So if we can catch it at the low end, we're able to save those teeth. And although we can replace teeth with dentures and partials, nothing is as good as what God gave you. And so that's where we really want to be on that forefront as, okay, we can replace the teeth that have already been lost, but what can we do to save the ones that you have now?
I think there may be some older adults that are afraid of the dentist. Dentistry's come a long way, probably since they were a child, and I hope they hadn't had a bad experience, but they may have. I find that older adults are often less likely to tell you that they're afraid as well, and then you get in a situation where their blood pressure starts going up while you're working, and that could be dangerous. So, ensuring that the older adult feels comfortable, and all of the clinics in the network, all of their providers, we've been going through training together on how we can best serve the unique needs of older adults, because they are unique, and a 70-year-old and a 90-year-old can be very, very different in their mobility and ability to communicate or even care for their own mouth, and 2 90-year-olds can be completely different in that as well. So it's very individualized care, but we're taking that. This is an opportunity for all of us as a state to learn how better to care for each other. So it's a pretty exciting part of the program.
This mobile unit has a unique aspect in collaboration with local churches, which we work with. You're able to get the patients in their own environment, so their fear and anxiety is reduced. And also, as part of the mobile unit now, we're checking blood sugar as well as blood pressure and doing A1C checks. So that those people who are pre-diabetic, we're also directing them to the healthcare organization to try to get them a primary care provider so that we can not only work on dental care, but we can work on the other aspects of healthcare as well.
'Cause it's all
Everything-
connected, right?
everything is,
Yeah.
everything is
Yeah.
coordinated, okay?
Yeah, and I don't think we should underestimate the power that the older adults have over their grandchildren and their children on saying, you know, this doesn't have to happen. We can keep our teeth for a lifetime. It is not inevitable to have an extraction. You want to go get care early, get care often, make it a priority.
Well, and even trends in moving towards prevention in dental. I mean, I think maybe I took that for granted, you know, as I, you know, grew up, you know, you go and, you know, you see your pediatric dentist and then you get handed off or whatever. But for older generations, folks who are maybe turning 65 now or in the or older subsets, that type of preventive care didn't perhaps exist, or there wasn't as much of a culture of doing that. Is that kind of another, I mean, it sounds like there's so many barriers potentially.
Well, in rural Tennessee, a lot of people, transportation is a problem, of course. And even if they have transportation, to get to a charitable clinic, is, if they have one, is impossible. And then the cost, across the United States, 21% of people don't get care because they can't afford the cost, and that's across the thing. It's higher in rural Appalachia. So those are all aspects that come into the whole picture.
Let's talk a little bit about, okay, what, you know, 3 years is the time frame that you've got. What are your goals? What are you hoping will accomplish?
Well, we're going to have people after the 3 years that still haven't been able to get in the program and have a dental home met. So we're hoping to have the data to show that this network is well prepared to do this. It's cost effective, it's delivering the kind of care that older adults want, and it's making a difference in overall health and quality of life for seniors. So we're going to want others to come forward and help fund this after 3 years. And you know, the nation is watching. We've been telling everyone that we're doing this. This is an opportunity that no other state has had. No one is doing it at this level. We can really show what Tennessee's made of.
Well,
The ultimate goal would be to be able to keep the program and expand it at the end. Right. Not just the 3 years and say, okay, that's all we're going to be able to do. We want to continue this program, expand it, and see more and more people so that we can get more than 200,000 people.
Right. Well, I mean, is there a policy aspect to this, like where, you know, trying to change that, either availability through Medicare or expanding Medicaid?
The surveys of older adults show that they want dental in Medicare, and older adults vote higher than other population groups. So that would be the dream, is if it would be included in Medicare, and then this program wouldn't have to be there. That would be ideal.
Right. Well, we've run out of time. I very much appreciate you all being here, and I want to thank you for your participation. For more information and to watch all of the programs in NPT's Aging Matters series, visit our website at wnpt.org/agingmatters. And thanks for watching.